Good afternoon, viewers. Namaste. This is Dr. Aparna. I am your emotional healing synergist. I am an Ayurvedic psychotherapist, a passionate infopreneur, edupreneur, and medical writer. I am on my pursuit of a mission to promote, propagate, and address Ayurveda and psychotherapy globally. So, in this discourse, every week, uh, or rather precisely thrice a week, I come with a topic of discussion and uh, related to Ayurveda or mental health or psychotherapy. So, today's topic of discussion is CBT. CBT is the most requested topic of discussion. People have asked. As an Ayurvedic psychotherapist, I'm always asked about CBT and what is it. Most of you might have heard of the word CBT, but most of you don't know what exactly it is. So, today I will explain what is CBT and what are the benefits and applications, core concepts, everything. So, let's go along. Let's start. So, CBT, the word meaning itself says that CBT is cognitive behavioral therapy. So, cognitive behavioral therapy. So, what is CBT? So, CBT, cognitive behavioral therapy, is a form of psychotherapy that focuses on connection between a person's thoughts, feelings, and behaviors. Focuses on the connection between person's thoughts, feelings, and behaviors. So, how? Cognitive behavioral therapy is a talking therapy that can help you manage your problems by changing the way you think and behave. So, cognitive behavioral therapy, as I said, is a talk therapy. So, what is it based on? It is based on the basic principles from both behavioral and cognitive psychology. So, CBT, is it the next question would be, is it evidence based? Of course, cognitive behavioral therapy is evidence based treatment. So, it is a goal oriented, practical approach that aims to help individuals to understand their thoughts, beliefs, and influence on their emotions and actions, and how to develop healthier and more effective ways of thinking and behaving. So, CBT helps you become aware of inaccurate or negative thinking so that you can view challenging situations more clearly and respond to them in a more effective way. CBT focuses on challenging and changing cognitive distortions. What are cognitive distortions? Such as thoughts, beliefs, and attitudes, and their associated behaviors to improve emotional regulation and develop personal coping strategies that target solving current problems. So, CBT focuses on challenging and solving the current problems. How? So, it changes the cognitive distortions and their associated behaviors to improve emotional regulation and develop personal coping strategies so that a problem is solved. So, CBT is based on. So, what is CBT based on? CBT is based on. So, CBT is based on the idea that our thoughts and interpretation of events significantly impact our emotions and behaviors rather than the external event themselves. So, see what CBT is based on is, it is the idea that our thoughts and interpretation of the events, suppose something negative happened or bad happened, that significantly impact our emotions and our behaviors rather than the external events. See, it is the internal fight basically. It addresses the internal fight rather than the external fight. So CBT, then it suggests CBT is, it suggests that by identifying and challenging negative and unhelpful thoughts, individual can modify their emotional responses and improve their well-being. CBT is widely used in the treatment of various mental health conditions, including depression, anxiety disorders, phobias, post traumatic stress disorder, obsessive compulsive disorder, eating disorders, and substance abuse. It can be used in many more things, but basically, it was, widely used in the treatment of mental health conditions, which I mentioned now. So, CBT is a useful tool to address emotional challenges. For example, what are the emotional challenges it can address? So, it may help you manage symptoms of mental illness, prevent a relapse of mental illness symptoms. So, treat a mental illness when medications aren't a good option. See, every psychiatric medication, as it has benefits, it has side effects and adverse effects as well. So, most of them have side effects, and a few of them have been banned because of their adverse effects. So, when a medication can't be prescribed, then CBT is a useful technique, useful treatment methodology. So, learn techniques for coping with stressful life situations in the normal daily life situations, also for the stress and anxiety, for the generalized conditions which we, deal with daily. We don't have, we can use simple cognitive behavioral therapy to manage that, and identifies ways to manage emotions and how to respond to a situation. I also mentioned this I mentioned in while in my last session when I was talking about NLP. So what it was it also said that we cannot control what happens in our life, but we can control how do we respond to it, or how do we deal with the situation. So, CBT also helps to manage emotions, resolve relationship conflicts, and learn better ways to communicate. This also helps in better ways to communicate, as I said, to respond, cope with grief or loss of maybe your loved ones, or loss of finance. So, whatever it may be, your personal or professional loss, it will help you cope with it as well. Overcome emotional trauma related to abuse or violence. Cope with a mental illness. So, medical illness, even if you don't, even it is a physical medical illness, you, mind psyche is also associated with it, because a person becomes mentally also weak when he has a medical illness. So for that also CBT can help. So manage chronic physical symptoms. So physical symptoms like pain also, it is also said that CBT can also manage chronic pain, help in managing chronic pain. So how? So it is the train your brain formula. So we can train our brain, rather our mind, to to respond to the chronic pain. So, what are the core concepts of cognitive behavioral therapy? So, what does, you will ask, what does cognitive behavioral therapy help? So, what are the techniques and what does it do? Like the core concepts of cognitive behavioral therapy are cognitive restructuring. So, what CBT believes and recognizes is, CBT recognizes the influence of our thoughts on our emotions and behaviors. It focuses on identifying and challenging negative or irrational thoughts and replacing them with more realistic and adaptive ones. By restructuring our thinking patterns, we can change how we feel and behave. So, cognitive restructuring is nothing but, if somebody has a negative feeling or a negative thought or a negative core belief, you just replace it with a positive one. and an adaptive strategy. So, by restructuring our thinking patterns, we can change how we feel and behave. So, next is automatic thoughts. So, automatic thoughts are the immediate and often unconscious thoughts that arise in response to a situation or event. CBT emphasizes the identification and examination of these automatic thoughts, as they can significantly impact our emotional and behavioral reactions. Suppose, how does this automatic thought replacing work is, if some person has a suicidal thought for at the moment that something bad has happened, he has a suicidal thought. So this technique, the automatic thoughts, changing the automatic thoughts, and CBT emphasizes in identifying them and examination of these thoughts, of course with the help of a therapist, as they can significantly impact our emotional and behavioral reactions. So, cognitive biases. So, what are cognitive biases? Is cognitive biases are inherent mental tendencies that can distort our thinking and perception. CBT helps individuals become aware of common cognitive biases such as all or nothing thinking, catastrophizing, and overgeneralization. By recognizing these biases, we can challenge and correct them to think more accurately and realistically. So, cognitive biases is, if I do this, this will happen. See, it is one is overthinking, and one is overgeneralization, and one is you believe that if I do this, people will think this about me, people will do this about it. So, this overthinking, overgeneralization, and catastrophizing thinking is, when you think fully, totally, irrelevantly, and when a person such has such, and we use CBT to, get rid of these cognitive biases. And what happens is, when we apply CBT in such cases, CBT helps individuals become aware of common cognitive biases, such as, all or nothing thinking and overgeneralization, overthinking this, they can come out of it. So, behavioral activation. CBT emphasizes the importance of engaging in the positive and healthy behaviors as a means to improve mood and overall well being. So, CBT also helps in positive and healthy behavior, emphasizes on positive and healthy behaviors to improve mood and overall well being. It encourages individuals to set and work towards achievable goals, increasing their involvement in activities that bring a sense of fulfillment and pleasure. So, when you start, the cognitive behavioral therapy, the first emphasis we do is on your achievable goals. First is goal setting, on achievable goals and realistic goals. And when you replace your negative thoughts and negative patterns with the positive thoughts, positive behaviors, and positive patterns, or in a productive work or in a productive goal, your general health also improves, like your mood and overall well-being also improves. So CBT also contributes in the mood and overall well-being of a person. So exposure and response prevention, this concept is particularly relevant for anxiety disorders and obsessive compulsive disorder. See, obsessive compulsive disorder is the disorder. Anxiety, I think we all have heard of. So, obsessive compulsive disorder is a thing. See, if you you switch off the gas, you are closing the when the milk boils, you switch off the gas. You go back, but then you have a doubt that, did I switch the gas off? You go and check it repeatedly. You and you lock the key, but you're not aware that you've locked your key of the house, and you go and repeatedly check and repeatedly think of it. So this is a small, Minor example of obsessive compulsive disorder. So things, they do it repeatedly, they have to do it repeatedly because there is no awareness and recognition of what they've done. So, CBT employs exposure therapy, where individuals gradually face, see, CBT, exposure and response prevention is exposure is, and exposure therapy is also this, in which if you have a fear for something, you are being exposed to that environment so that you get rid of that fear. So that is what they're telling, where individuals gradually face feared situations or stimuli, along with response prevention, which involves resisting the urge to engage in compulsive behaviors. Through this process, individuals learn to tolerate anxiety and break the cycle of avoidance and ritualistic behaviors. So, this process, you resist your fears. If you resist your fears, you can't get out of the fear. So, you have to face the fear. It helps in facing the fear and break the cycle of avoidance and ritualistic behaviors. So, skills training. CBT often incorporates skills training to equip individuals with effective coping strategies and problem solving skills. These skills may include relaxation techniques, stress management, communication skills, assertive training, and anger management, among others. So CBT also, in the CBT treatment, we also incorporate, as I said, skills training. So what are the skills? Why we do that? To For the effective coping strategies in order to solve the problem. So these skills may include relaxation techniques, stress management, communication skills, assertive training, and anger management. Next, what we do is collaborative therapeutic relationship. So, CBT emphasizes the importance of a collaborative and supportive therapeutic relationship between the therapist and the client. The therapist works together with the individual to set treatment goals, develop strategies, and monitor progress. The client's active participation and involvement in the therapy process are integral to the effectiveness of CBT. One thing is, CBT involves or emphasizes on the collaborative and supportive work of both the therapist and the client. See, if the therapist is putting all the efforts and client is not willing to actively participate and involve in the therapy and involving developing strategies and setting goals, treatment goals, if one of the thing also lacks, the treatment cannot be, or the therapy cannot be completed. It would be rather incomplete or relatively fragmented. So both active involvement of both the therapist and the client are required for the active management. So these core concepts form the foundation of CBT and are utilized to address a wide range of psychological disorders and promote positive change in individuals' thoughts, emotions, and behaviors. CBT is full of, playing, with involves only your thoughts, emotions, and behaviors. All, all the three. So it is relatively integrated with all your thoughts, emotions, and behaviors. So usually there are 5 easy steps of CBT which I can explain. There are many techniques and many steps, but what we do in a layman's term, if I have to say, these are the 5 steps. So 5 easy steps to changing your thinking using cognitive behavioral therapy. How? First, what we do, make a list of the problem. And step 2 is record unproductive thoughts. Whatever the unproductive thoughts are there, we record that. And then what we do is create replacement thoughts. So, create replacement thoughts is, if he has a negative thought, negative patterns, we replace it with positive thoughts, positive patterns, and goals. strategies, development strategies, and realistic goals. So next, read your list often. So we tell them to keep a journal and write all the developments, whatever they feel their developments, and tell them to read what is the improvement. Yesterday it was like this, today it is like this, tomorrow it is like this. We It is a continue process. So step 5 is notice and replace. So whatever improvements are there, we are, keeping it. Whatever they, again there are negative patterns, and again there are negative emotions, and what we do is we then replace them again. This is a cycle. So, as humans, we learn how to do almost everything. Very little is innate. So, innate thing is very little. We have to learn everything as humans. We explore everything and we learn everything. Much of how we think was learned from the people with whom we grew up. So that's true. Our parents and extended family, our teachers and coaches and our peers. Sometimes the thought patterns we learned were good, other times not so much. The good news is that if we identify thought patterns are overly negative or unproductive, we can teach ourselves new ways of thinking. That is what I told, train your brain. We can train your brain, or train your mind rather. So that is the good news, because these are not, permanent. So one way to accomplish this is through the cognitive behavioral therapy, technique of cognitive restructuring. In cognitive restructuring, we identify unproductive ways of thinking, catch ourselves thinking those thoughts, actively stop the thoughts and reject them, and replace them with new, more productive ways of thinking. So, as I told, I'm elaborating on the, 5 steps. So, what is step one? Step one, I told, get a sheet of paper. Okay, you can from top to bottom, from, and the left hand column you are going it to title old thoughts or unproductive thoughts. On the right hand column you will be writing it as replacement thoughts. So what were your old thoughts and what are the replacement thoughts, that you have to make a list. So step 2 is record unproductive thoughts. In the left hand column, start writing out this you can do it now as well actually. That means you can make a note of what I say, or keep this video and just do it. You can follow this so that you will get to know what are, at least you will get to know what are your unproductive thoughts. So it will help in productivity and time management as well, if not anything for you as of now. So, in the left hand column, start writing out unproductive thoughts, as I said, and you find yourself thinking on a regular basis. If you do this, if you cultivate a practice of this, you will do it regularly. These could be anxious or worried thoughts, highly negative or self critical thoughts, thoughts that display a lack of self confidence and are self deprecating, or any other thoughts that hold you back or make you unhappy. Write out these thoughts in the first place, the way they sound to you when you speak them to yourself. So, write all of things, whatever negative thoughts you have. It may be anxious or worried thoughts, it may be negative thoughts, it may be self critical thoughts, it may be a self deprecating, it may be lack of self confidence, whatever it is, you write it down. Next, what we do, step 3 is create replacement thoughts. So, how do we create replacement thoughts? Now, in the right hand side, so right hand side, we are writing replacement thoughts. So, in the right hand side, what we do is, um, you're going to create a replacement thought for each unproductive thought you wrote down. So when crafting your replacement thoughts, there's few different ways to approach the process. First, you can try just writing the opposite of your negative thought. So this, though this alone is almost always too simplistic, another way to approach is to ask yourself, if my unproductive thoughts is a lie or is untrue in some way. If it is it really that I'm lacking, or is it just I'm thinking that I don't have confidence? Is it really I if feel anxiety, or I think that I can't speak or I can't communicate, I have a public fear, I have a fear of heights? Is it really that is happening, or it is just in my mind? So this, then what is the truth? You'll get to know if you know do this process. No, if you repeat this process, I don't say in one one go you will get this, but if you repeat the process, you will automatically get the answer. So another way to approach is to ask yourself, if my unproductive thoughts is a lie or is untrue in some way, then what is the truth? Or in less dichotomous language, if my unproductive thought is only partly true or incomplete, then could I tell myself that would be more accurate or convey a more complete and realistic picture of my situation? The replacement thought should be more productive, constructive, and self affirmating than the original thought. So, if you have suppose, let's think that you have a fear of public speaking and you feel anxious when you go to public. So, what can be your replacement thought is, okay, next time I will give it a try. I will try once. When I feel anxiety, it might be incomplete, so I will give it a try. I'll go, even if you could not talk, you will just go and give it a try. Even if you get blank, you will just go and give it a try, right? Then that would be more accurate or convey a more complete and realistic picture of the situation. So the replacement thought should be more productive, constructive, and self-affirming than the original thought. Be sure that your replacement thoughts does not consist of you lying to yourself and telling yourself that everything will be okay. No, we are not doing that. Okay, I'll go to the stage and everything will be okay. No, you will tell yourself that you will give it a try. You'll try to speak at least a paragraph or at least 10 words, whatever you have prepared or whatever is in your mind. Okay, then be sure that your replacement thoughts don't consist of you lying to yourself and telling yourself that everything will be okay. If that's not necessarily true, this isn't about self deception. We are not deceiving ourselves, we are improving, we are getting better. That's it. This is all about coaching yourself through a difficult situation or emotional reaction that, in a way that focuses on the positive and affirms your ability to affect change within yourself and in the world around you. So the step 4 here, step 3 is you have created the replacement thought. So step 4 is start reading through your list of replacement thoughts at least twice a day. As I said, this is completely a practice oriented approach. So you have to start reading. Okay, I have a fear of public speaking. Now I'll start speaking. At least I'll stand on the stage and just start speaking. I usually recommend that clients read their lists first thing in the morning upon getting out of the bed and last thing at night before jumping into bed. Over time you will start memorizing the wording and content of your replacement thoughts so that you can use them throughout each day. So step 5, notice and replace. So fourth is read your list. So fifth is you notice them and you replace them. As you go through your day, notice when you think one of your unproductive thoughts and stop yourself. Take a moment to reject that old way of thinking. You might envision yourself throwing that through away in the trash. So visualization, when you visualize that, you are getting rid of your public speaking fear. For example, we are taking the public speaking fear, that is a general fear or fear of stage. So you're throwing you envision that you're throwing your anxiety, your nervousness, your fear into the trash, and then speak the corresponding replacement thought. So the corresponding thought is, no, from next time I'll go stand on the stage and I'm gonna speak whatever I can, whatever I remember. Even if people laugh at me, it is good, it is okay, but I will not come back before I speak something. or I will not feel anxious at least. And then speak the corresponding replacement thought to yourself and let it sink in. So let it sink in your brain. Don't worry if thinking that new thought didn't change how you feel. That will come with time, right? So once you think, okay, next time से मुझे fear नहीं होगा, you're not going to get fear, and you'll be okay. It does not happen like that. It might not happen as you are, feeling. But what you do is you just continue with the process. The trick is to cognitive reconstructing is consistency and perseverance. In the beginning you may have to reject and replace thoughts many 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 times a day, but at some point, instead of thinking the old thoughts, you will find yourself automatically thinking the replacement thoughts. So, apprehension, you will find that your thoughts will, from apprehension, will be, replaced by the assurance. Like, no, oh, I can't speak, I can't do this, I have fear of heights, I have fear of public speaking, I can't do this. Say, what will happen is, I will do this, I can do this, I will go and speak uh, publicly. I will face the fear of heights, or I will face the fear of water, whatever it is. So, with that, so, and this is when you will know that your hard work is paying off in everything, The one thing constant is your efforts. And here, if you have the right strategy, you will get the desired outcome. So, efforts plus the right strategy will give you the desired outcome. So, with what I wish you good luck with your thought retraining. Okay. So, if you find that you have trouble crafting effective replacement thoughts that really address the roots of your unproductive thinking, then consider working with a professional counselor. At this stage, if you cannot do, try this at home for a few days. If you cannot do, you can approach a professional counselor or a therapist. So CBT is typically a structured and time limited therapy with specific goals established collaboratively between the therapist and the individual. It involves active participation and engagement from the individual as they work together with the therapist to identify the change patterns of thinking and behavior that contribute to their distress. CBT is considered as an evidence based therapy. I have already mentioned this, with numerous studies supporting its effectiveness in treating with a range of mental health issues. So, CBT stands for, as I said, it is a psychotherapy that focuses on helping individuals identify and change negative thought patterns and behaviors that may be contributing to their emotional distress or mental health issues. CBT is based on the idea that our thoughts, emotions, and behaviors are interconnected and influence each other. This is very true because everything is interconnected and they influence each other. So, CBT techniques can vary depending on the individual and their specific challenges, but the underlying principle is to identify and modify negative thoughts and behaviors to promote positive emotional well-being. So, there are types of cognitive behavioral therapy. This I will talk in the next session. Before that, what we'll do is we'll talk on the next main question, that is, what is the like time period and what is the time period needed, where and the benefits and applications of CBT. So where can it be helpful? So what are the key benefits and applications of cognitive behavioral therapy? So effective treatment for mental health disorders, I said. So CBT has been extensively researched and has demonstrated effectiveness in treating a variety of mental health conditions. I'll talk about the conditions, detailedly in this session itself. So, what does it do again is empowers individuals. CBT empowers individuals by helping them developing coping skills, problem solving abilities, and self help technique. It teaches individuals to become active participants in the treatment process and enables them to take control of their thoughts, emotions, and behaviors. So, next, it focuses on the present. CBT is a present focused therapy that emphasizes understanding and addressing current problems and symptoms. It helps individuals identify and challenge unhelpful thoughts and behaviors that contribute to their distress, allowing them to make positive changes in their lives. So, CBT is a present focused therapy, so that emphasizes understanding and addressing current problems and symptoms. So, identifies modifies negative thought patterns. CBT helps individuals recognize and challenge negative or distorted thinking patterns such as catastrophizing, overgeneralization, and all or nothing thinking. By identifying and modifying these patterns, to individuals can develop more balanced and realistic goals, leading to improved emotional well-being. What it emphasizes mostly on is the emotional well-being, that is improved emotional well-being. So betterment, so behavioral change and skills development. CBT incorporates behavioral techniques to facilitate change in maladaptive behaviors. It helps individuals set realistic goals, break them down into manageable steps, and develop practical strategies to achieve those goals. This includes exposure therapy, behavioral experiments, and the development of new skills to replace unhealthy behaviors. So, long lasting results. CBT focuses on equipping individuals with the skills that can be used beyond the therapy sessions. As I told now, the 5 steps, it is not only used in therapy, you can use it beyond therapy as well. The techniques learned in CBT can be applied to various situations and challenges throughout life, providing individuals with long lasting tools to manage their thoughts, emotions, and behaviors effectively. So it can yield in long lasting results. So once you develop the technique, as you go on practicing, it becomes your habit, and it changes, long lastingly changes, because it has tools and strategies to help manage thoughts, emotions, and behaviors. So, complement to medication. CBT can be used alone or in combination with medications. It has been shown to enhance the effects of medication and reduce the risk of relapse in various mental health conditions. CBT can also help individuals better understand their condition, improve medication adherence, and manage medication related side effects. It can use adjuvant with the medication, or it can be used alone as well, CBT. So when used with the adjuvant, it helps manages the medication related side effects as well, and it enhances the treatment. So, prevention and relapse prevention. CBT can be used as a preventive approach to reduce the risk of developing mental health conditions in individuals who may be vulnerable. It can also be effective in preventing relapse by identifying triggers, teaching coping skills, and providing strategies to manage high risk situations. So, CBT is also versatile and adaptable. CBT can be adaptable to suit the needs of different individuals and age groups, including children, adolescents, and adults. It can be delivered in individual therapy, group therapy, or through online platforms, making it widely accessible and versatile in various settings. So, it is versatile and widely acceptable and adaptable technique. So it can be an individual therapy, it can be a group therapy, or through online platforms. For some conditions, we do it as an individual therapy. For some mental health conditions, we call the family members of the clients to do a group therapy, or with some other clients as well to do as a group therapy, or through an online platform. So overall, CBT offers a structured and evidence based approach to therapy, providing individuals with practical tools and strategies to manage their mental health effectively and improve their overall well being. So after this, what we do is, what are the limitations of CBT? So when we have advantages and effectiveness, we also have this. First, let's see what are the effectiveness. See, CBT is an extensively researched and it has a wide range of, it can be used in treating a wide range of mental health conditions. So what the effectiveness itself is, it has a strong evidence based, and it is a treatment of choice for certain conditions, mental health conditions. I will just elaborate the conditions as I go, as we go forward. So empirical support, and it can be like given with medication as well, as I said, and it has an active and collaborative approach. So it also focuses on long term benefits. We've talked about all these effectiveness. When we talk about an effectiveness of the treatment, we also have to talk about limitations. It would be rather incomplete if we don't talk about limitations of CBT. So even if CBT is regarded as effective therapy, but it has some limitations. So not one size fits all approach. So CBT, one size cannot fit all. So CBT may not be suitable for everyone or every mental health condition. Some individual may not resonate with its structured and directive narrative, preferring alternative therapeutic approaches that better align with their needs and preferences. So, for some, it is not suitable, and some people may not resonate with CBT. So, for them, we use different psychotherapy approaches. So, time and commitment required. So, CBT typically involves regular therapy sessions over a specific duration. It requires individual to actively engage in some homework assignments, practice newly learned skills, and implement changes in their daily life. This level of commitment and effort may be challenging for the individuals who are not ready or motivated to actively participate in the therapy process. So, after this, time and commitment is very much required from both, not only from the therapist, but also equally from the individual or the client participating in the cognitive behavioral therapy. Limited focus on underlying causes. While CBT is effective in addressing symptoms and providing practical strategies, it may not deeply explore the underlying causes or root causes contributing to mental health conditions. Some individuals may benefit from additional therapy approaches that delve into their past experiences and explore deeper emotional and psychological factors. So, reliance on individual motivation and effort. CBT is highly reliant on the willingness of the individuals to engage in self reflection, challenge their thoughts, actively working on changing behaviors. Lack of motivation or engagement can limit the effectiveness of CBT, as it requires individuals to take active role in their own treatment. So not CBT is not a quick fix solution. It is not a magic. So CBT is a structured and goal oriented therapy, but it may take time and effort to see significant improvements. It requires consistent practice and application of skills outside the therapy sessions, and progress can vary from person to person. It's important to note that these limitations do not undermine the overall effectiveness of CBT, but rather highlight areas where alternative of complementary approaches may be considered for certain individuals for specific situation. A skilled therapist can access the individual's needs, access and assess the individual's needs, and make appropriate recommendations to optimize treatment outcomes. So you have to definitely approach a psychotherapist when it comes to a mental health condition. To treat a mental health condition, a counselor or a psychotherapist is definitely required. You cannot do it on your own. Okay. Then the main and important question I've been asked always is, what is the Aparna, what is the duration of cognitive behavioral therapy treatment? See, I cannot guarantee like what is the time. So treatment can vary depending on several factors. What factors? Including the nature and complexity of the client's concerns, their treatment goals, their progress throughout the therapy. It also depends on the progress of how, what were they feeling yesterday, what are they thinking today. So generally CBT is considered a time limited and goal oriented therapy with a focus on achieving specific outcomes within a defined time frame. So the number of CBT sessions can range from as few as 6 sessions to 20 sessions or more, depending on the client's needs and the nature of the problem being addressed. This is important. What is the nature of the problem addressed? How intense is the problem? How severe is the illness? So that much time is needed, and that much sessions are needed. So from anywhere between 6 sessions to 20 sessions or even more for some severe mental health illnesses. So typically sessions are scheduled weekly or bi-weekly, allowing for regular progress and reinforcement of therapeutic gains. So it may be scheduled weekly or bi-weekly, once in 7 days or once in 15 days, according to your therapist and the progress of the client. So it is very important to note that CBT is often structured and follows a treatment plan tailored to the individual client. Treatment goals are collaboratively established at the beginning of the therapy, and progress towards these goals is regularly reviewed and assessed. The therapist and the client work together to determine the appropriate duration of treatment based on the client's progress and needs. So, as I said, it is a collective and collaborative approach. It depends on both the therapist and the individual, how motivated and willing the client is to change, okay, to their replacement thoughts. In terms of follow-up, the frequency and duration of follow-up sessions after the completion of CBT treatment can vary. Some clients may benefit from occasional booster sessions for follow-up appointments to ensure maintenance of the progress and to address any new challenges that may arise. Follow-up sessions are typically less frequent than regular therapy sessions and can be scheduled as needed basis. If a treatment requires follow up sessions, then follow up sessions are also taken to ensure, they are also called booster sessions, to ensure the maintenance of progress and to address any new challenges. So this decision, the decision regarding the need for follow-up sessions is made collaboratively by the therapist and the client, taking into account the client's ongoing needs, preferences, and therapist clinical judgment. These follow-up sessions can serve as a form of support, reinforcement of skills, and prevention of relapse. What does the follow up session do? It can serve as a form of support, prevent the relapse. So it is important to remember that the duration of CBT treatment and the need for follow up will vary based on individual circumstances, and the therapist will work with the client to determine the most appropriate plan for their specific needs. For any specific needs, again, it is collaborative. Therapist and patient or the client will decide that how many sessions or the follow up sessions are required. So I think if I go on talking about CBT, no, this will not end. So for this session, I will think I will, end this session for today, and I will talk about this in the next session that in what mental health conditions actually CBT works, what are the techniques, some case studies and all. So stay tuned for more. And for that's it for today's session. Please stay tuned for more, so that I'll be back very soon on another CBT session. So thank you, everyone, for if you are still staying tuned. So, and namaste everyone, thank you.